ways that informed consent is not honored today in terms of medical experimentation or medical whatever. Talk about that.
Well, the modern wave of what I call the erosion of informed consent can be traced back to 1990, when the Department of Defense asked for and received a waiver from the FDA that permitted it to subject soldiers to research without asking their permission. And it was fairly wide-ranging. There were a number of initiatives, including an experimental anthrax vaccine, a quite troubled vaccine, by the way.
This was used in Desert Storm for the first time, right?
Exactly. And also, drugs like pyridostigmine as a possible protection against biological weapons. But these were drugs that were untested for these uses, and in some cases, quite risky. Now, risk is part of medical research, but in this case, the soldiers had never been given the chance to say yes or no. So that's when it began. In 1996, it was expanded to all Americans when an addendum was added to the Code of Federal Regulations, which stipulated that someone who was unable to give consent, typically translated as unconscious, is in a life-threatening situation, and there's an experimental drug that might help them. However, unfortunately, that's not... that was actually confusing to consumers. It sounds like it's a life-giving, a life-saving move, but it's not. Laws already exist that allow people to be given drugs if they can't give consent.
Right.
This allowed them to be given untried, untested drugs. By definition risky, by definition not guaranteed to work.
Not just the best-known therapy for that particular
something
ailment.
Other than the best-known therapy.
Right.
An unknown therapy. And today we have more and more people, corporations, private corporations, exploiting that rule to test their therapeutics. In my opinion, typically on populations who would not give their consent if you asked them.
And is there an element of racial bias? Does this affect African Americans more than others, or?
As is not unusual when we're talking about medical issues in this country, there are aspects that do affect African Americans more than others. It's not a racial issue. Everybody's at risk. But there are some ways in which African Americans are at heightened risk. For example, if I look in Detroit at one particular experiment with a blood substitute, all the people in Detroit who suffered harm as a result of this research were black. And they use heavily minority communities in some of this research.
Now, in the Detroit study, this blood substitute, did they know they were getting the substitute blood, and did they know what the risks were?
No, these are all people who suffered trauma, who were given it while they were unconscious or otherwise unable to give assent to care. So they knew nothing until after they had been given it, and they were in the hospital, sometimes days later. Only then were they told that you received this experimental therapeutic.
And were there some deaths as a result, or not?
There were. People did die in this trial.